Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I have just a simple case here where we're going to use a cervical headgear to kind of bring the anterior teeth back a little bit, and it kind of holds them in so they don't grow out, and the lower you free it up. Now they're getting away from the headgear much and using this appliance. They hook up to the cuspids and go back to the molars back there with that, and that corrects the class 2 problem that we're using here. And then the only complication in this case is where we reduce the deciduous second molar. And I did this years ago, and at this point I don't have any of the x-rays left on that case to show you where we trim those teeth, but I can show you in the mouth how we trim the teeth to do a pulpotomy on them. And let's get started on this. Just a pretty short, simple case, and people can do this type of thing. So let me see, we'll have to touch this and we'll go. This is a cute little girl. She's just really a sweet child, and she's got just a minor class 2 problem and some crowding. And so we went in to do this, and we're going to use a cervical headgear, and I'll show you how. And it's a commonly used type. We used them quite frequently back in the 70s, and that's when this case was done. She has a very good facial structure. I mean, it's ideal, and just a real good, sweet little girl. And the case is the upper centrals are coming in a little over jet, and the laterals are coming in up here, and they're kind of sprawled out to the side. Now a lot of times laterals do that. The permanent cuspid will be coming down in here somewhere up in the tissue, and it'll push the root over to the side, and as it comes down here, it'll bring it back in that direction. We've got a little diastema in here, but don't have to worry about that. As this cuspid teeth come in the mouth, they're going to push that together again, so you don't have to worry about that portion of it. And on the right side of the mouth, it's nearly class 1. See, actually you've got the lateral, the cuspid, and the first deciduous molar, the second deciduous molar, and there's a 6-year molar back here. These are 6-year molars, so you're in the mixed dentition when you go in here to get this started. Now you've got 4 permanent teeth up here, and you'll have 4 permanent teeth out here, and 3 deciduous teeth on each quadrant like that, and that you have to bring those teeth into place. So let me get on with this. And on the other side of the mouth is a similar situation. It's fairly close to class 1. It's not too far. Now you've got your first deciduous molar and your second one, and now the 6-year molar really should be up in here somewhere. So it's a fair class 2, and the overjet is more than you want right in here. So we're going in and straighten all this out. And here is the upper, just looking straight at this. I don't think the young lady had any habits that were too bad. Anything in a problem like that, we've got a certain amount of crowding, and you notice how these laterals are sitting like this, and those cuspid teeth are right up in underneath here. Now this is a deciduous cuspid, so you'll have your permanent cuspid coming in, and it'll be much larger than the deciduous one. And this is, of course, this is the first deciduous molar. It's about the same size of the bicuspid. The second deciduous molar is considerably larger than the bicuspid, so we're going to trim it off down here and do a pulpotomy on it. Now let's go on, and I'm just running through everything we did on this. You wouldn't have to know all this. Now, on the bottom arch, the deciduous cuspids are a lot smaller than the permanent cuspids. And if you leave those teeth alone, they'll come in. Now, the young lady had good swallow habits, good tongue habits, and everything. These teeth are lined up real nice here. Now, there's not enough room in this area for that tooth to come in. So a lot of times we'll go ahead and take out the deciduous first molar, and then let the cuspid come in. And then we've got to figure out how much we're going to need after the cuspid gets in for the permanent second bicuspid, and then we'll take off from the deciduous second molar, and let me show you how we did that. Now we do a pulpotomy on it. I don't show it. Now right at first, we went in and took out the deciduous first molar, and that lets the cuspid come in and have plenty of room. And now the bicuspid is down in this area. The first bicuspid will come up in this area, and it'll start in, and it'll move this cuspid over close to that. Now let's go on to the next slide. The same thing on the other side. So we took the first deciduous molar, let the cuspids come in perfectly fine without any problem. And now I'm going to do the pulpotomy on the deciduous. Let me go back and show this. We did the pulpotomy. We sliced the deciduous molars, deciduous second molar now. Let me go back and see if I can find that other one. We took both of these teeth down and took the nerve out, just going in through here, opened it out and took it out, pack it with that hard mixture of zinc oxide and eugenol, and that takes care of that. And you don't have to worry about that tooth anymore. You make plenty of room for the second bicuspid to come through. Now we put a retainer. Now we've got the upper braces on these teeth right in here, and we use a headgear, and we've got in a headgear tube on the 6-year molar out here. And I'll need to show you a little bit about the headgear. You want the headgear to raise up in the front when you pull from the back here. Now if you just go straight out in here and hook onto the headgear, it tends to drop the front teeth. But if you kind of bend the headgear up and now go back, and when you pull on it, it tends to raise the headgear so that it's not pulling down on the upper front teeth. And this is worn just as much as they can. They don't have to wear it to school, but if they wear it around the house and sleep in it, you could bring the teeth back on quite a bit. Just depend on how diligent they are about wearing it. Headgear is an excellent tool to get force from the back of the neck back here, and then of course we get occipital headgears, and you can have a straight pull headgear, but this is the most common that we used to use. We don't use as many now as we used to, of course. And now you raise that up, and when you hook it up, this will raise up a little bit, and it tends to tilt your molars back some. She's a sweet, happy little girl, and she looks like she doesn't mind wearing this headgear. So now I'll show you where we made room for the second bicuspid to come through. We made room here for the first bicuspid, the cuspid tooth to come in here, and then this will be the first bicuspid, and there'll be enough left over. When that bicuspid comes in, it'll move right up against that reduction of this tooth. You take this down, you go in and take the pulp out from this end and go down and fill it with zinc oxide and eugenol. It's really a real tight, hard mix of it, pack it in there like amalgam. They've got videos showing you how to do that. And then this tooth will have more than enough room here for the second bicuspid, and here'll be your first bicuspid, and you'll have some extra room in here, and this will move forward into a class 1 relation a lot of times without doing much pulling on it to get it in. Now we'll go on over here. Let me go ahead and erase that, and we take those teeth down, and your teeth will come in and never be crowded or crooked at all. And so we see now here's your 4 anteriors, and here is your cuspid tooth, first bicuspid, and the second bicuspid is going to come in here, and then this tooth will move forward into a better class 1 relation. Same thing over here. Cuspid, first bi, second bi will be in there. And then you get some forward drifting of the 6-year molar, and the wisdom, the second molar will follow in behind that. Let's erase that. Here it is. You remember I told you a while ago you don't have to worry too much about closing this space. As this cuspid came down by this lateral, and when it was in here, the lateral was up there, and the cuspid came over, pushed this lateral back, closed the diastema, line this thing up like that. And now we are waiting on these other teeth to come in, and this is the first phase of orthodontics, and she's not going to need any second phase. Now this tooth down here, the 6-year molar back here will drift in where you reduce this deciduous molar. This filled in here, you've got some extra space, and this will move into a pretty well class 1 relation there now. And that's over here the same way. This tooth is moved in and taken up this extra space, and you've got plenty of room for your bicuspid tooth to come through there. So here is the upper now, and we've got the plenty of room here. We put a little retainer in with a bite plate, and she'll wear that till the permanent teeth all get in place. And I don't think this young lady had to come back for any second phase to this. Now look how let's see, you've got your cuspid, your first bi, and the second bi will be right in here with a little extra space. This will come forward, and your second molar will follow in behind that. This is 1973. That's backward. I put the note down there, and then this is pictures turned around. And over on this side too, plenty of room for the second bias to come in. Up above, the same thing. You've still got a portion of the deciduous second molar. And we did this reduction of the teeth with the pulpotomy so that we would just let nature bring these teeth into place. And look how they close this up right here with very little or anything in there. Now there's the headgear tubes, and we use that, and we had it raise these up, these teeth just slightly, so our overjet and overbite looks good. And now I don't think I'll go to the end of the case here. Now this is 1973 when we did this. And now the lower anterior. So you don't have to worry. The person's tongue pushes this in place, and the lip structure holds it back, and it brings the teeth into that correct spot. That's where the pressure is equal in this direction, and also from the labial direction right there. And that's the end of this case, except we've gone through this first phase, and in this particular case, the bicuspid should come in without any problem. Let's see, I messed up my little deal here. Anyway, I thank you for watching, and we'll go back and end this up. But this was the first phase of treatment, and I don't think you would have to come back to do a second phase at all in this particular case. So the child never did experience crooked teeth. They would have been crowded coming in a little bit. You'd have had to done something to it. I don't know what about the wisdom teeth in here. You'd have to take care of them. If there's room for them, keep them. If there's not, then you're going to have to take them out. You don't want to leave the wisdom tooth that's extremely crowded. Will crowd up the other teeth. And so I'll say goodbye and thank you for watching. And join our group and subscribe to it. We'd enjoy that. And I'm going to say goodbye and close out. Thank you now.